Okay, everybody, Dr. Rayfich here from Vet Triage. We are continuing on with this issue of JAVMA from June 15, 2015. We'll be talking about lessons learned and knowledge gaps about the epidemiology and control of porcine reproductive and respiratory syndrome virus in North America. This report comes out of the college in veterinary school in Minnesota, Iowa State. It comes from Guelph in Ontario. And also IDEXX laboratory in Maine, as well as Vetmedica in Missouri. So this is more of a case review of this disease, and this is 2015, so it's a little bit outdated, but it does tell you a lot of good information about the epidemiology of viruses, especially after COVID. And so we'll go through this. It is a long one, but for folks who care about this disease in pigs, this is a good one to know about. In 1989, there was reproductive disorders in sows and respiratory disease in growing pigs, southeastern United States. Then 1991, they found a Lylystad virus, that's Lylystad. This was found in the Netherlands. And then in the United States, there was a prototype virus found called VR-2332 in 1992. Then PRRS, which is the porcine reproductive and respiratory syndrome, we're going to abbreviate it to PRRS or PRRS, was chosen at the first International Symposium on Emerging and Re-Emerging Pig Diseases in St. Paul in 1991. No evidence of the PRRS virus prior to 1980, whereas 1 out of 26 herds had positive results in 85 and 63% of samples had positive results in 1988. The European strain is referred to type 1, North American strain type 2. The annual cost of PRRS virus in the United States is $560 million in 2005 and $664 million in 2011. The incidence of PRRS has been difficult to estimate, in part because differentiating new PRRS virus introductions from resident or vaccine strains requires virus sequencing and interpretation of sequence results, which can be challenging. There was the American Association of Swine Veterinarians PRRS Task Force, referred to as the National PRRS Incidence Project, in 2011. And the highest rate of this disease is seen in mid-October, and then it subsides each spring. Now, regarding molecular epidemiology of the PRRS virus. Similar to other viruses of the Artyriviridae family, this is a species-specific, highly resistant to cold temperatures and highly variable virus because of its high mutation rate and potential for recombination. So recombination is when the genetic material of the organism will mix and match, and so combining that with a high mutation rate, which is the alteration of the normal baseline nucleic acid genetic code of a virus, makes it highly likely to change form, and therefore it's difficult to kill. Epidemiological features of outbreaks for various geographic levels include global and continental, and as well as regional, local, and farm levels. The United States, Canada, China, Korea, Denmark, Italy, Vietnam, and Thailand have all been affected. The restriction fragment length polymorphism is used to identify strains, so that's a genetic test. In contrast, the PRRS viruses identified in environmental samples were related with less than a 1.2% nucleotide difference to viruses that were in experimental settings, inoculated in grow to finish pigs, so that's young to older pigs, located far away, which suggests that there's an airborne dispersion of the PRRS virus over long distances. Analysis of the open reading frame 5 sequence suggests that both long distance and local transmission are important. Introduction of pigs and geographic location were associated with a 19% and 33% increase of risk, respectively, within the PRRS virus spread. 40% of outbreaks in which local spread was suspected were located within 3 kilometers or 1.88 miles of an infected farm, and aerosol transmission was suspected in many of these outbreaks. In Quebec, at least one strain or more was detected over a 3-month to 4-year period. Results also suggested that the PRRS virus may persist on a farm for up to 3.5 years, with as little as 2% variation in the open reading frame 5 sequencing. In 78% of the herds with multiple submissions, genetically different strains were identified. In a study conducted in the Midwest, genetic variability among farms, among pigs within farms, and within individual pigs accounted for 92.94%, 3.84%, and 3.22% of the total variability, respectively. All right, so within farm transmission of the PRRS virus, routes of shedding the virus include saliva, nasal secretions, semen, urine, feces, and mammary gland secretions of lactating sows. Intranasal, oral, and intramuscular transmission. The amount of viral shedding depends on the strain type, with less shedding occurring of less virulent strains, like the strains called MN-30100 or VR-2332, more so than virulent strains like MN-184, by all routes including aerosol. In 1992, transmission was detected 99 days after infection in a sow, but other reports say 220 days, 56 days, 119 days, little evidence for anything beyond 200 days. Vaccines help reduce the shedding of the virus. The route of exposure appears to play a role, where higher doses are required for oral versus intranasal exposure, and lower doses for intramuscular. In general, the virus is susceptible to inactivation by heat and drying. Infective virus was not recovered from a variety of common surfaces and materials at temperatures from 25 degrees to 27 degrees Celsius. At temperatures between negative 20 Celsius and negative 80, the virus can be stable for months to years, but infectivity is quickly lost when a pH of a solution is less than 6 or greater than 7.5. Stability in manure and stability in manure has been evaluated, and viral survival depends on time and temperature. The RO, which is the number of secondary infections in a fully susceptible population given contact with one infectious individual through the duration of an infective period, is important for modeling of pathogen spread and identifying cost-effective strategies for disease control. Results for a model of within-farm viral spread suggest that herd size is negatively associated with the probability of achieving stabilized status, and that repeated mass vaccines with acclimatization of gilts, which are young sows, is more effective for disease control than in single exposure. So that's herd health. That's the herd health mentality. Acclimated gilts were assumed to have a period of infectivity, 70% the duration of for unacclimated gilts. Vaccine efficacy is assumed to be 92.5%. It was concluded that a larger magnitude of the R sub O, which again is the number of secondary infections that can occur, and larger herd health, a larger herd size, both had been a negative effect on the likelihood of achieving stable status. On the basis of results of that model, herd closure together with acclimatization of gilts and repeated mass immunization was a scenario that resulted in the highest number of iterations that achieved stable status. This was followed by acclimatization of gilts plus repeated mass immunization, and then by acclimatization of gilts plus a single mass immunization. Authors of that study argued that repeat mass immunization, so giving the vaccine every 15 weeks, was a more effective strategy for minimizing frequency of infectious animals at 200 weeks than was a single mass immunization, and therefore did not recommend a single mass immunization for PRRS control. And again, that's the whole herd health concept. Now, between farm spread of the virus. Between farm spread of the virus may occur through a number of routes, which include live pigs, semen, vehicles, people, tools, equipment, supplies, food, water, non-swine animals, insects, and air, so like everything. Testing of the serum or semen from boars by use of a PCR is used to detect the presence of the virus RNA. You can use swabs or blood collection, and you want 3 samples per pool. For movement of swine, pigs represent the most important transmission vector. Live swine that routinely are moved include replacement gilts and boars, weaned pigs, growing pigs, and these are moved between production sites or cull animals and market pigs, purchasing gilts from virus-negative sources, and isolation of purchased gilts prior to entry into a herd. Now, vehicles. Livestock trailers. The virus can survive in feces for 120 hours at 4 degrees Celsius. Contaminated livestock trailers included washing as the first step. However, washing alone is not enough. Sanitation practices using a combination of disinfection and drying is recommended. Allowing trailers to dry overnight following the wash has been found to reduce the risk of contamination. Disinfection with a quaternary ammonium glutaraldehyde product applied with a hurricane fogger was effective. Another study conducted evaluated the efficacy of commercially available disinfectants at 4 degrees Celsius, and the same quaternary ammonium glutaraldehyde product, along with other products, is useful at negative 20 degrees Celsius of the quaternary ammonium glutaraldehyde product mixed with 10% solution of propylene glycol or 40% methanol solution also eliminates the virus. Heating trailers to 71 degrees for 30 minutes or applying thermal assisted drying for 2 hours is also efficacious. In regard to people, their boots and coveralls are risks. Practices to reduce risks associated with drivers include using disposable plastic boots and boot baths with 6% sodium hypochlorite, which is bleach, changing boots and coveralls, washing your hands, showering, allowing 12 hours of downtime. All that combination can be efficacious. Regarding tools, equipment, and supplies, there is a higher frequency of transmission in cold weather. The use of plastic bags and containers that hold equipment and supplies may be brought onto a farm and might have contact with the virus. Food and water, pork meat, looking for viral RNA can be found with a PCR assay in pork muscle. Now, in regard to non-swine animals and insects, houseflies, mosquitoes, and stable flies are mechanical or biological vectors. Houseflies, like the Musca domestica, mosquitoes, like the Aedes vexans, and stable flies, like the Stomoxys calcitrans, are risks. You can use insect screens and insecticides, and pyrethroid-based insecticides were recommended. Non-domesticated animals and birds like mice, rats, mallard ducks, prairie dogs, avian species can also transmit the virus, but these are inconsistent findings. Prairie dogs, known as Cynomys ludovicanus, Muscovy ducks, mallard ducks, guinea fowl, and chickens sporadically can spread infection. Aerosol transmission, so air transmission was not detected in another study. Weather conditions favorable for aerosol spread of the virus include wind direction from the donor to recipient pigs, higher barometric pressure, lower humidity. More pathogenic isolates might be more likely to transmit by aerosol. Reduction in the risk of aerosol transmission by HEPA filters, with and without large particle pre-filters. Various fiberglass and electrostatic filters all can be used. The point estimate of the payback period for farms with a conventional attic filtration system was 5.35 years, whereas a combination of attic and sidewall system, which is more expensive, the payback period 7.13 years. The use of quaternary ammonium glutaraldehyde disinfectant in an evaporating cooling system failed to retain aerosolized viruses in one or more replicates, and then using radiation lamps emitting UV light also seemed to fail to reduce the aerosol transmission. All right, now controlling and eliminating programs at the farm level. So you can classify a herd's viral status by using a criteria with 5 status categories, ranging from positive unstable, which is 1, through positive stable, which is 2A or 2B, provisionally negative, which is 3, and then negative, which is 4. So herds are classified as status 1, so this is 1, during the active acute phase of the infection, when weaned pigs have positive results when tested for the virus by using PCR. After 4 consecutive monthly tests are negative over a 3-month period, then they could be stable status 2A if the long-term decision is to control the virus, or 2B if the decision is to eliminate the virus. Herds are classified as status 3 after replacement animals have been introduced into the herd and remain seronegative by using an ELISA. for a period of at least 2 months. Finally, status 4 is achieved by complete turnover of the herd, depopulation, repopulation program, or a period of 12 months, so 1 year, since the beginning of status 3 and animals are confirmed seronegative by the ELISA. Whole herd depopulation and repopulation is the most effective means of eliminating a virus from the herd. The two most common of these methods are partial depopulation and herd closure. Test and removal methods have important financial and logistical considerations and are rarely applied in the swine industry except for farms that produce boar studs. Overall, the median time to production for virus-negative pigs is 27 weeks. However, there was considerable variation among herds. At the initiation of a herd closure program, 3 methods have been used. These include vaccinating all the sows with live virus vaccine, challenge exposure of sows with serum containing the live virulent virus recovered from the herd, or exposing sows to material obtained from tissues of infected baby pigs. And these are all just variations of immunization. Now, control and elimination programs at a regional level. The eradication of the virus from pigs has been successfully achieved in Chile, Sweden, and South Africa. And keep in mind this paper is from 2015. So, evaluation of herd demographics and in participating regions, obtaining viral infection status for individual sites, detailed biosecurity assessment, mapping of important site and area characteristics, and design of control strategies and subsequent monitoring of farms and nearby areas have been recommended as part of such programs and are frequently implemented. Now, regarding observational studies, the spread of the virus amongst herds, some studies relied on serologic testing, others have involved broad classifications based on the types, like European versus North American, on the basis of serologic results, and genotypes on the basis of the restriction fragment length polymorphism. Classification can be based on phylogenetic trees and different cutoff points to categorize variants into groups or matrices of similarities to assess correlations between the similarity of nucleotide sequences and spatial and other proximities amongst herds. Some investigators have relied on descriptive statistics, contingency tables, Cox proportional, some investigators have relied on descriptive statistics, contingency tables, Cox proportional hazard models, generalized additive models, and methods to detect spatial and space-time clustering and clusters commonly used in spatial epidemiology. Statistical models of individual level infectious disease transmission, results of the mantle correlation test, and linear regression based on a permutation approach. What you should gather from this is the complexity of epidemiology. There's multiple techniques used. They rely on a ton of data, which can be very difficult to get because virus infections move so quickly, and we tend to react so fast with it. So you can see now why something like the COVID-19 pandemic was such a mess. These things are very difficult to chase, and you're dealing with animals here, which has its own challenges and some things that are not so challenging compared to people. In a cross-sectional study of 103 swine herds in the United Kingdom from 2003 to 2004, a sow herd of less than 250 sows and a distance of over 3.2 kilometers, which is 2 miles, from the nearest pig herd were factors that increase the odds of having negative results for exposure to the virus. In another study of risk factors for virus circulation in swine herds in the United Kingdom, over 15,000 pigs in a 10-kilometer or 6.25 mile radius, collecting dead pigs, as opposed to incineration of pig carcasses, use of a live vaccine, and weaning of pigs at 21 to 27 days of age, as opposed to weaning at over 28 days of age, were risk factors for viral circulation. Other risk factors include herd size of over 300 breeding females and less than 2.5 kilometers, 1.56 miles to the nearest pig site. Factors associated with the risk of introducing the virus in the United States were herd size, introduction of animals from herds positive for the strain, purchase of semen from boar studs positive for the strain during a risk interval, and cumulative exposure attributed to nearby herds infected with the virus in the United States. The median time to a reported outbreak in herds with a high external risk index was 12.7 weeks, whereas median time in herds with a low external risk index was 107 weeks. Other important factors contributing to a shorter interval during a PRRS outbreak were establishing a new herd during winter season and startup at a new site, as opposed to establishing a herd through depopulation, repopulation at an existing site. As far as virus prevalence, to less than 2%. Disease investigations for this program suggest that 56% of possible sources of PRRS cases were attributable to the introduction of infected gilt and baby pigs. 19% were attributable to contaminated semen, 21% from fomites or slurry, and 3% from other causes or unknown causes. The authors report that herds within 500 meters of the site of a PRRS outbreak had a herd PRRS prevalence of 45%, whereas prevalence for herds that were over 1 kilometer away was only 2%. They concluded that airborne transmission was infrequent except for sites within extremely close proximity. And we saw earlier that also aerosols more of a risk factor with more virulent strains of the virus. The risk of new viral genotype used was between 2.3 and 10-fold as high for unfiltered herds and increased linearly with cutoff values used to define a new introduction. The authors suggested that a cutoff point of 3% to 5% was the most useful to define a novel introduction for the purposes of that study. The authors also estimated that on the basis of a cutoff of 5%, 80% of novel viral introductions could be attributed to airborne spread in the target population, so herds with good biosecurity in pig-dense areas. Okay, next section, disease control programs for PRRS. PRRS disease control programs are in France and Sweden and North America. Regarding surveillance and testing, first described in 1895, representative sampling was not applied to swine until the late 1970s, where sampling for the United States pseudo-rabies virus eradication program replaced the whole herd testing used in the eradication program for classical swine fever or hog cholera. The standard of collecting 30 samples is a legacy of this area. In terms of dynamic population change, the constant introduction of new immunologically susceptible animals promotes the circulation of pathogens. In regard to connectivity of subpopulations, in 2011, nearly 40 million live swine and the pathogens they carried were moved across state lines. This included 6 million feeder or weaned pigs imported from Canada and shipped to the United States Corn Belt. This pattern of moving pigs closer to food sources provides an efficient network for the rapid dissemination of viruses and other pathogens. This is why there are such strict guidelines for moving animals across state lines and between countries for this reason. These conditions favor pathogens because herd immunity is tenuous and unstable. In addition, the transport of large numbers of pigs between sites provides the means for pathogens to rapidly reach geographically distant populations. For example, the number of within and between state movements of pigs increased from 30 million in 1970 to 50 million in 2001. Oral fluid-based assays are capable of excellent diagnostic performance. The diagnostic sensitivity and specificity of a commercial serum antibody ELISA modified to detect IgG antibodies against the virus in pen-based oral fluid specimens were estimated at 94.7% and 100% respectively. The shortcomings of oral fluid samples is that it needs effort to collect the oral fluids from the animals. Infection with the virus does not result in pathognomonic clinical signs, so the choice of testing method, meaning nucleic acid or antibody-based testing, is an important consideration for surveillance. Both serum and oral fluid specimens are suitable for nucleic acid, meaning PCR assay, or antibody-based testing, but each diagnostic method has advantages and disadvantages. The detection of nucleic acids reflects current circulation of pathogens. This is important from the viewpoint of timeliness. However, nucleic acid assays are more expensive than antibody-based assays, and the test performance has been an issue. Antibodies are abundant in serum and can be readily detected in oral fluid, and the cost is low compared to PCR-based assays. In contrast to nucleic acids, antibodies provide a prolonged window of detection because they reflect recent and past exposure. On the farm level, antibody assays are compatible with continuous monitoring of population immune status by use of control charts. On the other hand, point-in-time detection of pathogens and nucleic acid may be useful for pathogen characterization or vaccine development. Ultimately, selection of the best testing methods should be dictated by the purpose of testing. And in conclusion, this includes the availability of tests that are reliable, accurate, and highly reproducible among laboratories, as well as laboratories capable of meeting standards of quality assurance and quality control. Above all, surveillance must be simple, flexible, and accepted by users, or it will not be conducted. There it is. So a pretty excellent overview of this virus. It certainly sounds scary when you read about it and you think about it. This is just one virus of many that affects not just pigs, but large animals, small animals, people. So it's pretty crazy. So for veterinarians out there, especially those who practice on production animals, this is of course something to keep in mind in terms of biosecurity and practicing good quality medicine. You have to encourage your clients that sometimes spending money on something may not seem like it's worth it because you're spending money on preventative measures, but as the famous saying goes, you don't see 100% of the accidents you prevent. And then for pet owners, especially those who are animal owners of pig farms, you invest the money now so you don't lose a ton more later on. And it's good medicine for the animals, better production for consumption, all that good stuff. So it just makes sense to invest now so you don't lose later. All right, that's it for this video, a long one, but I'll see you guys in the next one. Bye-bye.